First, though, we turn to Canada's premiers who have been meeting today to digest the federal election result and plan their next move. Their priority demand isn't new. For more than a year, they've been pushing Justin Trudeau for $28 billion more in healthcare transfers. Trudeau has been promising less than that and with strings attached. The BC Premier, John Horgan, expected to speak any moment. In the meantime, we've got the CBC's David Cochrane in the Ottawa newsroom. David, this is a file, of course, that you've been following for quite some time. What do you expect to hear from this now united front of premiers? Yeah, well, the demand from the premiers today is a familiar one. They want the immediate increase from 22% of total healthcare spending from the federal government to 35%, and they want the annual increases capped with a minimum escalator of 5%. And they're also asking for a First Minister's meeting prior to the throne speech, which would restart Parliament once it's reconstituted after the election results are finalized. So they want that to happen sometime in the next couple of weeks, if not a month or so, and certainly by the end of the calendar year. So it's not an unfamiliar issue, and that the premiers want to sit down with the Prime Minister to call for a massive increase in annual healthcare spending, then with predictable big increases every single year. Now, that's not necessarily what Justin Trudeau ran on and what he was reelected on. Rather, it's a series of more bespoke healthcare funding from $1 billion to help with the proof of vaccine costs, $6 billion to eliminate wait lists, $3 billion to hire 7,500 new family doctors, and then $9.5 billion over 5 years for long-term care, and another $4.5 billion over 5 years to create a new mental health transfer dedicated specifically to mental health. What Justin Trudeau hasn't yet said is specifically what he would do on the annual healthcare-based transfers, because these are one-off targeted funding allotments that's campaigned on and that he's offering to the premiers. And there was an attempt to get him to commit to this prior to the election during the height of the second and third wave when he met with the First Ministers. And the Prime Minister's argument at the time was that, look, let's get through the pandemic and then we'll have this conversation afterwards. Obviously, there will be an increase of some sort in the health transfers, but for the most part, for the last little while, it's been just at 3% a year, and the premiers want that to go up to 5% a year. Trudeau would not commit to any specific number, only that he would sit down and have a conversation. Now they've put a more specific time frame on when they want that conversation to happen. Right, so it's about money, a lot of money, and the premiers don't really want any of those strings attached, and the Prime Minister seemingly is quite likely to want strings attached on all or at least part of that money. What do you expect, and when would we expect to hear it from the Prime Minister? It's hard to say. I mean, right now we're still waiting to hear from the Prime Minister because nobody's heard from him since election night, right, when he won. I mean, what is happening right now is they're meeting and planning the transition back to government, but they want to see what's happening with these vote counts, right, to know exactly what their caucus is and how many seats they have. We just had one of the Quebec ridings that the Bloc was leading on election night flipped to the Liberals in special ballots, and that is now a Liberal hold, and so you add one and deduct one. So there's a lot of those things that are happening. But, you know, it's going to take 3 weeks, maybe to 4 weeks before there's a cabinet in place and before they're ready to go. So they need to do the vetting of the new candidates and the new ministers to make sure they can get that going. You presumably would want to have made a final decision on who your finance minister and your health minister are going to be before you have this meeting. Now, I would be shocked if Chrystia Freeland moved. I do not yet know if they're going to make changes in health. But, you know, because it's really a money argument when you're talking about healthcare funding. So I think we just need to see how quickly they're going to get back to work. I mean, my expectation is we'll hear from Justin Trudeau on Monday because all of this counting should be done by late tomorrow, if not into Saturday, and we get a clear sense of exactly what the Parliament is going to look like. But, you know, he's certainly... If you listen to his speech on Monday night, he said we were told to get back to work and get through the pandemic. Well, the premiers are a key part of that. So I don't see how there's any reasonable way that the Prime Minister could refuse to meet with the First Ministers. Now, whether it's before the throne speech or, you know, sometime later in the fall, that will need to be sorted out. But they do need to figure out exactly what the long-term sustainable picture on healthcare funding will be. And already you're seeing, you know, Mr. Blanchet from the Bloc Québécois trying to put the squeeze on Trudeau, agreeing with the increase up to 35% of funding and calling for a complete match of the Premier's position. So you're already seeing some of that as the smaller parties try to exert their leverage in the minority parliament. Yeah, and when you talk about Chrystia Freeland, Minister of Finance now, certainly a big part of that picture in terms of what kind of what kind of money they're going to put forward. Healthcare transfer is obviously a big file for all the premiers, but where are the other issues that sort of divide some of those premiers and some of the provinces from the federal government right now?
Yeah, I mean, these jurisdictional issues are always going to be the things they squabble about, right? And in particular, you heard Francois Legault during the election and after the election making clear he doesn't want any kind of an intrusion on this. It'll be interesting to see where we go on the vaccine passports and the vaccine mandates. We've seen the prairie provinces sort of begrudgingly come to the table on adopting this in various levels of effectiveness and efficiency, for example, but there is money on the table there. And how they're going to react to the restrictions coming in on travel that the Prime Minister promised during the campaign to make it impossible to fly or take an interprovincial train without proof of vaccination. So some of these things, there could be some jurisdictional issues and some political tensions on it, but immediately I think you'll also see, speaking of Chrystia Freeland, renewed discussions with Ontario on the childcare program. I know this is something Doug Ford has voiced tonight, saying that he wants a deal with the federal government on this. And we talked about this the day after the election. He's got a vote of his own coming up, right? And a lot of the people in the suburban 9 of 5 in particular who voted for the Liberals, Doug Ford needs those votes if he's going to hold on next time, and being able to offer them that childcare program is certainly something that he would like to be able to campaign on, because right around June of next year, if it's implemented by then, that's when you start to see the initial phase of the up to a 50% reduction in the overall average cost. So there's some tension points mostly about the jurisdiction and on the healthcare. And I know there's this consensus statement, David, from the Premier saying they want this much money and they want no strings attached. But, once the one-on-one conversations start happening on things like long-term care, right? Trudeau says he wants to put money into national standards on long-term care. The bigger, richer provinces, and Quebec, for example, may argue about that. But, smaller provinces like where I'm from, Newfoundland and Labrador, they need money, they'll take money. They will take it whether it's targeted. So you'll find common ground there, and you'll see that consensus start to fray as the conversations, as the money gets put on the table and the opportunity cost is apparent to the premiers. There's a leveraging position, but then in the one-on-ones, it gets a little bit different and easier for the federal government to get some wins.
Yeah, very easy to put conditions on money when it's $1 billion plus on the table.
Exactly.
All right, David Cochrane, long week for you and for everybody else in the Bureau. Thanks so much for your smarts on this. Appreciate it.
Thanks, man.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.